Good afternoon, class. This presentation will inform and address the strategies that can be applied to reduce depression in people with physical disabilities and its comparison to the LGBTQ plus community. People with physical disabilities have many health needs that should be addressed to improve their health outcomes and to counteract depressive symptoms. There are many types of physical disabilities, which can include cerebral palsy, spina bifida, epilepsy, multiple sclerosis, arthritis, vision loss, and hearing loss. There is a possibility that they could experience restricted mobility, inaccessibility, and inequality because of their condition, so it is crucial to address the general health. This consists of regularly checking their body temperature, blood pressure, heart rate, body mass, and etc. They could also be at risk for mental disorders, such as psychosis, affective disorders, and psychiatric problems, due to the need to cope with stress, stigmatization, and neglect. Chen et al. 2017 stated that people with physical disabilities have a threefold increase in experiencing depression in contrast to the general population. Therefore, their access to mental health services is crucial. They can also experience issues with accessibility and mobility in certain places, so it is essential for adjustments and inclusive programs to be arranged. This can include the use of sign language and braille, which are beneficial forms of communication for certain conditions. In addition, providing assistive technologies such as wheelchairs, screen readers, walkers, and adjustable desks are essential. Support services such as physiotherapists, occupational therapists, speech pathologists, and psychologists can be provided to help them with schooling, transportation, and housing. This will allow the task of daily living to be accomplished independently and to help this population to travel, communicate, learn, work, and participate in social activities.
People with physical disability have faced many health inequalities that impact their mental well-being. Throughout history, they have been exposed to inhumane treatment and were afraid, ignored, and prejudiced by the general population. They were disrespected with inappropriate terms such as handicapped, unfortunate, or crippled, which lead to their experience with ableism, stigmatization, and discrimination. They were denied the right to make their own decision and were hospitalized and institutionalized by force. They were also rejected from receiving education as school facility did not accommodate to their needs and limited their mobility. This unpleasant experience raised awarenesses about the challenges that people with physical disability have faced and the importance of acknowledging their health needs. Addressing these challenges would promote social inclusion and acceptance. This will allow people with physical disability to access their health needs and improve their well-being.
There are many issues that tend to affect the lives of vulnerable groups within the community, specifically people with physical disabilities who have depression. They have often challenges. They often face challenges when using health services in Australia, which can lead to a decrease in their life satisfaction and well-being. The Australian Institute of Health and Welfare 2024 stated that in the years 2022 and 2023, the Australian Human Rights Commission reported that approximately 25% of the discrimination complaints were from people with physical disabilities. This population encountered many challenges in gaining access to health services. The issues that can decrease access to health services can include lengthy waiting times. About 24% of people with physical disabilities waited longer to be seen by a GP, and about 29% who urgently needed medical attention waited a day or more. Financial burdens can also impact access to health services. People with financial burdens often delay seeing their health professionals or do not see them at all. At least 7.6% of people with physical disabilities needed to see their GP, and 4.6% needed to see a medical specialist. Access to health services can decrease due to issues with care coordination across different providers. About 21% of people with physical disabilities reported an absence of proper communication between health professionals. This can lead to patient dissatisfaction, medical errors, and inaccurate diagnosis. In addition, at least 12% had trouble in accessing medical facilities, and at least 3.5% experience discrimination or negative behavior by health staff. According to the Australian Institute of Health and Welfare 2022, an estimated 36% of self-reported mood disorders such as depression for people with physical disabilities. Around 29% of adults with physical disabilities had access to mental health services or support services, which was reported between March 2020 and April 2021. Telehealth services consultation dropped by 21% for adults with physical disabilities in April 2021 compared to November 2020 by about 30%. The experiences of this population when using health services in Australia features the importance of creating an inclusive and accessible healthcare system. This is outlined in Australia's Disability Strategy 2021 to 2031, which identifies all levels of the government working together to aid people with disabilities to become equal members of the community.
People with physical disabilities and people of the LGBTQ community who have depression encounter various obstacles when it comes to healthcare. There are many similarities between the health experiences of these two communities, including long wait times, which can lead to increased anxiety and patient dissatisfaction, the cost of services for private healthcare, and discrimination. The Australian Institute of Health and Welfare 2024 stated that approximately 83.9% of adults have a physical disability, such that 1 in 5 or 22% of adults experience a form of discrimination, mainly named disability discrimination, compared with 1 in 7 or 15% of adults without disability. The Australian Human Rights Commission 2014 stated that about 65% of LGBTQ adults have experienced various forms of discrimination, such as homophobic abuse, in their daily lives, compared to non-LGBTQ adults. This includes receiving poor services from stores or centres, harassment, bullying, and unfair treatment. The Australian Institute of Health and Welfare 2024 provides a list of barriers experienced by people with physical disabilities. This includes physical barriers which prevent access to an environment. 48,000 or 50% of people with a physical disability require special and modified equipment to access transportation and parking comfortably. 24,000 or 25% of people need assistance during job hours to provide wheelchair skills for people who have difficulty stepping up. In addition, communication barriers, such as written messages that prevent people with vision impairments to read instead of using braille, auditory messages that may be inaccessible to people with hearing impairments instead of including captioning in videos. Moreover, social barriers, also known as the social determinants of health, can contribute to a negative mental state. The rate of employment of people with disabilities is 35.5%, in contrast to people without disabilities, which is 76.5%. In summary, people with physical disabilities and people of the LGBTQ community encounter different obstacles that can affect their quality of life and mental well-being. No et al. 2016 mentions that depression is associated with the societal attitudes, stress, social barriers, inaccessibility to healthcare, poverty, and much more. All the listed barriers of the two groups have a great impact on mental health, as it can aggravate their depression. Therefore, the increase in access to healthcare and the elimination of discrimination in society towards these two populations will reduce depression extensively and enhance their mental well-being. A recreational therapist incorporates leisure-based activities to help others reach their potential in life and increase mental well-being with the use of interventions to form a treatment plan. The Australian Government 2021 states the professional skills needed to meet the needs of people with disabilities and people of the LGBTQ community. 1. Use emotional intelligence, including treating others with respect, protecting confidentiality, and being honest. 2. Use patient-centered care as it focuses on improving the patient's mental well-being through attentive listening skills and shared decision-making. 3. Teamwork is important as it involves working with other health professionals and incorporating problem-solving skills to create a treatment plan.
Individuals who pursue a career in relation to the public health sector must have a deep understanding of the determinants of health, various research methods, and statistics. They should aim for the promotion of healthy living and execute the essential services, policies, and programs that include education. Public Health England 2016 states the professional skills needed to meet the needs of people with the disabilities and people with the LGBTQ community. The first things, use the skill in a competent manner throughout practice and always have a strong work ethic to stay constant, productive, and determined. Problem-solving skills are essential in the field of scientific research as they include statistics and the collection of data. Leadership as an important aspect of public health professionals, as it includes decision-making, conflict management, and the creativities of ideas.
Health service managers are required to cooperate with the public for the provisions of services and the facilitation of useful healthcare. There are many skills and abilities required to address the needs of people with physical disability and the LGBTQ plus community as a health service manager, which includes: 1 is cultural competence. Knowledge about the experience and challenges of this group is important to understand how discrimination and stigma affect people with mental health and well-being. 2nd, patient-centered care implies in providing individual-oriented services that are customized based on the patient's needs and values. 3rd, collaboration, working closely with interdisciplinary teams to coordinate patient care. 4th, communication, talk in a normal tone of voice, be polite and patient, and advocate the use of visual diagrams or communication board, or a language interpreter can be hired if unable to speak English.
A strategy that can be used to improve the health of people with physical disabilities who are depressed is cognitive behavioral therapy. Cognitive behavioral therapy is a form of talk therapy that is based upon the idea that altering one's thoughts would modify their feelings and behaviors. It is designed to treat emotional distress and can be delivered as individual or group therapy. This can motivate individuals to improve their coping skills and to reflect upon inappropriate, hurtful, or misleading thoughts. It can help people with physical disabilities who have depression to develop a rational outlook about their condition. CBT can educate the population about coping mechanisms that can be used when painful symptoms such as spasms, stiffness, or fatigue arise. These mechanisms can include progressive muscle relaxation, meditation, journaling, and etc. They can also benefit from CBT if they have sufficient social assistance. Therefore, delivering CBT as group therapy, where they can develop a sense of belonging and maintain friendships, is crucial. They can also be encouraged to engage in activities that meet their needs and abilities. For instance, sport activities like basketball, tennis, or football can be adapted to people who use wheelchairs, while swimming can be a great option for low-impact sport. These activities are important for their health and can reduce depression.
Cognitive behavioral therapy aims to increase quality of life and is effective in many conditions. It can help to counteract the self-stigmatizing beliefs and the self-discrimination that people with physical disability may have upon themselves. This can reduce the internalized shame that was caused by the negative views that the public has about them. Cognitive behavioral therapy can also be adapted to people that are part of the LGBTQ community who have a depression. It can help them to acknowledge irrational thoughts and to understand and feel comfortable with their identity. This will empower them to express who they are and what their preferences are. In addition, coping mechanisms can be utilized for this population to help reduce distress emotions. The mechanism can constance of artistic expression such as art or music, meditation, deep breathing, exercise, and etc. They can also be encouraged to participate in supportive community and events such as the Sydney Murder Festival and the Brock Hill Festival. This will advocate for equal rights in the community and at the raise of compassion for other. Therefore, people part of the LGBT community who have a depression would have a higher quality of life and well-being.
Thank you for listening to our presentation.